affiliated with, you can put that in the chat. And I'm going to have Megan Cunningham just give us an official welcome before we get started this evening.
Good evening, everyone. My name is Megan Cunningham. I'm the Managing Deputy Commissioner for the Chicago Department of Public Health. And on behalf of my colleagues, as well as our representatives from the U.S. Environmental Protection Agency, we welcome you to this evening's Health Impact Assessment session. We are really thrilled with the level of participation and engagement that we have tonight. We had close to 300 people registered. I think some folks are still working on getting access to the room. So don't worry, the session will be recorded for your benefit if you miss anything right at the very top. But I did want to honor that we have people here who are community residents of the southeast side of Chicago, Hegewisch, East Side, and South Deering. We have people here who represent environmental justice advocacy organizations, public health practitioners. We have Alderwoman Sue Sadlowski Garza and her team with us today, representatives from the business community on the southeast side, and many, many others who have interest in this permit application. We know that it asks a lot of your time to join us for 2 hours to talk about the health impact assessment and the work that we have before us. So we thank you, and again, we welcome you. So I'll give it back to Makara.
Thank you. Thank you, Megan. So I'm Makara Rumley, and I also have Nosa Avimbuan. We are from Hummingbird Firm, and we're going to be your facilitators this evening to make sure that we just really lead and have a robust discussion and get everyone's input about this health impact assessment. For those of you who missed some of the instructions when you first came in, just please, put your name in the chat. Say which organization you're affiliated with. That would just be wonderful. And we want to go over the objectives. You're spending your evening with us. So why are you spending your evening with us? And you are because we really just want you to understand the purpose and the process of a health impact assessment, or an HIA. The presenters this evening will describe how they are applying the HIA process to evaluate the Southside recycling permit application. They're going to identify potential community burdens and benefits. We're going to discuss environmental, health, and quality of life conditions on the Southeast side, and then also just compare these conditions to the city of Chicago and Lincoln Park. So those are our objectives. That's what we will be covering this evening. So I do want to just let you know who will be speaking to you, the names of who'll be guiding us through those objectives this evening. We have Megan Cunningham, who you've already met, Managing Deputy Commissioner. We have Melissa Binger, who's a Senior Policy Analyst who will be speaking with us. We have Kirsty Bosque, who's an epidemiologist. Renate Morante, who's an environmental engineer. Katie Siegel, who's with Air Toxics and Assessment Branch Manager at the US EPA, as well as Kate McMahon, who's the Director of Chronic Disease Prevention and Health Promotion. So before we get started, I do want to go over just some ground rules for this evening's discussion. There's a lot of folks on the call. And as we go into those ground rules, let's talk about the ground rules, and then we'll skip back to the agenda, Nosa. We know people are going to have different communication styles. That's okay. We want to be mindful. We only have a limited amount of time with you this evening, even though we have some subsequent meetings. So let's, make sure that everyone can be heard by being succinct and efficient in our comments and our questions. Please listen with an open mind. You're going to learn new things. We're going to dive deep, and you may have some questions. Give your feedback. whether that's, criticism or questioning. There are going to be multiple viewpoints. We're going to look to see, who's missing, who needs to be part of this discussion. There are 194 people here, but that doesn't mean that everyone who needs to be here is here. And then, in this virtual space, yes, you can talk out loud. You can put questions in the chat. You can email us afterwards. So please use all of the avenues at your disposal to communicate. Everyone here is operating with good intention and in good faith. And then we just want to, respect this space. And everything I've just covered has come from Elevated Chicago, from their community engagement principles and recommendations, because we want to make sure that we honor some of the solutions in terms of how we can best communicate with each other and create a safe space. So skip back to the agenda for me so we can just talk about how we're going to split up this time. We're going to do our best. Obviously, I'm right here at welcome and introductions. Kate McMahon is going to go over what an HIA is. We're going to talk about the process and the permit application for the Southside Recycling Facility. We're going to look at the current conditions of the Southeast Side. And throughout this agenda, there are going to be multiple opportunities for questions. So I know you just see it here at 6:30, but there will be multiple times and opportunities for you to ask questions throughout. So when we are asking questions, use the Q&A box. You can put comments in the chat, but try to use the Q&A box for questions, because that's where we'll be grabbing the questions from. It's just a lot to have to comb through the difference between a comment and a question in the chat. So just do your best to remember that. If you like to ask your question verbally, indicate that. You have an option where you can indicate verbal question, and then the host, who's NOSA, will elevate you so that you can ask your question out loud. We do want this to be a discussion, and that's what we have to do when you're in a webinar platform to make sure that we can have that discussion. We're going to do our best to answer the majority of the questions. There may be more than we can get to, but those answers will be provided after the meeting. And we do want to prioritize the voices of the residents from the East Side, Hegewisch, and South Deering. And in order to do that, put your question and then your neighborhood that you're affiliated with so that we can lift that question out for you. And then also just be mindful that what you write in the chat will be monitored. We're recording this, everything's saved, including the chat. So we want to be appropriate, and it's not going to go away when the meeting's over. So just wanted to bring that to everyone's attention. All right, so let's just level set, see where we are in terms of knowledge on how well you understand what a health impact assessment is, and what its components are. So NOSA is going to post a question for us. So on a scale of 1 to 10, I'm going to wait on a scale of 1 to 10, 1 being no trust and 10 being 100% trust, how much would you trust the health impact assessment process, and how do you that the process can make a difference? And so you should see the post pop up on your screen. I just saw somebody post some of their answers in the chat, but if you could put that same answer into the poll, that would be great. So you see here, how well do you understand a health impact assessment and its components? You can select, I understand it completely, I understand it mostly, I understand some, I don't understand, I'm not sure. And then you see that second question, which is the on a scale of 1 to 10 question, that you can go ahead and select that. And Nosa, I'm sure that when you see a good amount of people have participated, then you'll share the results.
Yes, so far we have about 35% participation, so I'm just waiting.
Yeah, let's wait.
Yeah.
And it looks like a third section question, which I think was planned to be asked later, but is a choice. It may pop up again, but if you want to, you can answer this third question as well, which is which of these impacts are most important to you? And there's a multiple choice list here. If what's important to you is not on this list, you can add it in the chat. No, so what percent participation are we at now?
50.
I know I see some folks saying they can't see the poll. I know you've heard the question, so you could feel free to put your answer in the chat. No, so why don't we just go ahead and share the results as we have them right now?
We'll be sharing the results again at the end, so closer to when we talk about health impact assessment, just because we want to make sure we're capturing question 3, but we'll capture question 3 later on. So if you didn't get a chance to go through the poll, I will end the poll and then restart it again once we're at that section. But we've captured some of the initial results. And if you aren't able to place your question in the chat, if you aren't able to poll or you cannot see the poll, just put your answer in the chat as well. And we'll be sure to capture that. Once we get to about 60%, I'm going to close the poll down. We're almost there. We have 3% left.
Thank you to everyone who's participating. We do need input and feedback in order to capture everyone's perspective.
Okay, I'm going to end the poll and continue sharing my screen. Okay.
All right, so I think it's time to just talk baseline and to start talking about the facts of what a health impact assessment is. And so I will turn it over to Melissa Binger.
I think I'm actually going to jump in, Makara. Good evening, everyone. My name is Kate McMahon. I'm with the Chicago Department of Public Health. And to help get us started, I'm going to share an overview of what health impact assessments are. So I'll cover why we do them, what they are, how we do them, and then their potential outcomes. So you can go to the next slide. Why do we do health impact assessments? We know that health is a state of complete physical, mental, and social well-being. not just the absence of disease. And many factors, including our social and economic conditions, our physical environments, influence how well and how long we live. And health impact assessments take a comprehensive approach to health. So they can help us to ask how a policy, plan, or project proposal affects the factors that influence health. And it's important to consider health when making decisions that affect living conditions, including the environment. Next slide. So how do you do a health impact assessment? A health impact assessment is a systematic process that helps determine the potential effects of a proposal on health before the proposal is implemented. We use an array of data sources, and it considers input from community members and other stakeholders to really understand the benefits and the burdens of the proposal. So as you can see from the image on the left hand of your screen, health impact assessments typically follow 6 steps: screening, scoping, assessment, recommendations, reporting, monitoring, and evaluation. And we'll start walking through those steps together later this evening. Next slide. Health impact assessments include many stakeholders, especially community members who will be impacted by the decision, as they're important stakeholders in the process. And this is really to share knowledge about existing conditions, to identify areas of concern and issues of interest, and to offer important contextual experiences. And engaging community members who will be impacted by the decision is critical in ensuring that equity is promoted throughout the health impact assessment process. Next slide. The City of Chicago defines equity as both an outcome and a process that results in fair and just access to opportunity and resources that provide everyone the ability to thrive. And equity is a core value of health impact assessment practice. Ways of incorporating equity in HIAs include supporting community engagement and participation in decision-making, focusing health impact assessments on proposals identified by communities who have been historically excluded from decision-making, and communicating findings and recommendations in accessible and actionable ways. Next slide. So sometimes there's confusion over what a health impact assessment is and what it's not, and then at what stage of the decision-making process it's applied. A health impact assessment is proactive and forward-looking. So it's meant to inform a proposed policy, program, or project before it's implemented. It engages stakeholders and uses data in ways that is transparent to identify the benefits and the burdens before a decision is made. It considers many factors that influence health and assesses potential short and long-term impacts. And then it explores the trade-offs between different decisions. So let's talk about what a health impact assessment is not. A health impact assessment is not an evaluation of impacts once a decision has already been implemented. It is not the final action required to implement recommendations, and it does not alter existing decision-making authorities, although it can inform how authority is applied and support future changes. Next slide. So what does this look like in action? On the bottom of the slide, you see a few examples of similar assessments that have either been conducted in Chicago or are underway now. And we know across practice that the outcomes of health impact assessments can include a greater understanding of health, what influences health, and the health impacts of decisions, increased community engagement and participation in decision-making, and changes to the design, adoption, or implementation of the proposal under consideration. And I think with that, I'll turn it back over to Hummingbird.
Thank you. Thank you, Kate. So based on, give me 1 second. I have too many boxes hiding things on my screen. So based on the information presented, in what ways could a health impact assessment benefit the community? And you can type your answers in the chat.
Okay, Makara, we're going to repeat the question one more time. So if you could just repeat it for participants.
Yes, based on the information presented so far by Kate McMahon, what in what ways could a health impacts assessment benefit?
We have a raised hand, so I'm going to allow Dolores to talk. Okay, Dolores, if you could just unmute yourself. Perfect.
Hello, can you hear me? I didn't know I was raising my hand. I was going to put this in the chat. I'm from the far south side, so I'm wondering why the far south side has not been included in this. And is this session part of the Healthy Chicago results or something else?
Megan, would you like to answer that question?
Sure. Yep. And we'll maybe do a bit of a parking lot on the which communities are being sort of considered in scope for the health impact assessment. We have a slide where we'll speak to that shortly in more detail. It is correct that the geographic focus for us has been primarily Hegewisch, East Side, and South Deering, the communities that are most proximate to the proposed South Side recycling facility and the locations that are most likely to suffer any negative harms or positive benefits from the presence of the facility. And yes, all of this work is part of Healthy Chicago 2025, and thank you for asking that question. Healthy Chicago 2025, for those who are not aware, is our citywide community health improvement plan. We created it in collaboration with hundreds of partners across sectors and community-based organizations. It is centered on closing Chicago's racial life expectancy gap. And addressing the living conditions like the environment, as Kate McMahon said, is a critical piece of that work. And embedding health impact assessment in our practice and in our policy is one of the central goals of Healthy Chicago 2025. So we are trying to really advance those values today. So thank you for that question.
Okay, we have one more person, Marcel, that I'm just going to elevate, and then we'll continue on. And whatever other questions, we'll have a Q&A portion at the end to discuss. So Marcel, you can unmute yourself.
Hello, can everybody hear me?
Yes.
Hi, so I do have a question. I do live in the East Side, and regarding to the health assessment, so I'm assuming it's going to set a precedent for what we are currently before the company begins operations, if that's correct. And then what if like 3 years, 5 years, 10 years down the road, we do start to have any kind of symptoms that are related to any kind of toxic metals that are in the air, which there already currently are, which we know it is below or within minimum EPA standards. When I do say minimum, so what if those parts per million go up? For instance, for all the children at the school attending the school, and do they get their own health assessment? Are they provided, or I think I heard something about the city provides some kind of a health assessment of sorts. So hopefully that, sorry if I'm asking too many questions, but that's my question.
No, what happened? That's all right. Thank you for the question. And I hear two parts in that. One is, does this process set a precedent for conducting health impact assessments of other industrial facilities and operations? And the answer is, In many ways, we hope so. Part of our effort as the health department in collaboration with the mayor's office is to use this process to really think about how the city overall in policy and in practice can really embed considerations of health and social factors and community vulnerability and environmental justice in permitting decisions, and even more fundamentally in how we think about land use and zoning in the city of Chicago. And so one of the explicit goals of this HIA is actually to inform that longer term policy change. To the second part of your question about impacts on individuals, that is a huge part of what we intend to discuss and to assess and to go deeper into through the continuation of this health impact assessment work. So as we talk about the methods that we're using and the sorts of data that we're considering, part of what we will address is how are we going to analyze potential environmental impacts through the lens of the effect that they have on a community member's health. So more to come on that through this session and then in subsequent sessions too.
Okay, thank you. I think do you want to raise one more benefit, Nosa, or are you ready to move to the next section?
So what we're actually going to do now is show some of the polling answers. And also to everyone who has their hands raised, you'll get an opportunity to ask some more questions in subsequent time. So I'm going to stop sharing my screen and just show the polling answers that you all answered in the very beginning. Okay, so based on the first question, which was how well do you understand a health impact assessment and its components, about 29% said I understand some, and 27% said I understand mostly. That was where most of the answers came from. 18% of you said I understand it completely. 17 out of the 115 answered I'm not sure, and 13 out of the 115 or 11% answered I do not understand. Now, the second question, on a scale of 1 to 10, 1 being no trust and 10 being 100% trust, how would you trust that the HIA process can make a difference? And the most responses we got was 1, which at 35 out of 115 of you responded. 2 was 8 out of 15. 3 was 15 out of 115. 4 was 10 out of 115. 5, I believe, got a second highest answered, which was 17 out of 15. And so on and so forth. So the third question, Megan, it's up to you if you want to.
Yeah, I think maybe let's hold that. We'll come back to the responses to question number 3. I do want to let folks know that one of the reasons that we're asking these polling questions is so that we can track changes over time. So, if we are not doing a good job today of assessing or of explaining what a health impact assessment is, it's important for us to know that so we can continue to reemphasize that over the course of our time together. We're also going to make sure that we are as clear as we can be in how we're applying these HIA tools to RMG. And so it may become more clear as we go what each of the steps of an HIA are and what they're intended to do. And it's also really important for us to just know and name that we have more than half of the people in the room currently saying that they don't trust that the HIA process can make a difference. I appreciate people for being candid about that. It is part of our job through the work that we're going to do in these sessions to earn your trust by being accountable and by being transparent, and we're going to strive to do that here. So thank you for the polling results, Nosa, and we can go ahead and continue on.
Perfect. So I'm going to stop sharing the polling results and open up the presentation once more.
Okay, so next, Melissa Binger, as well as Megan Cunningham, will talk about how they're going to apply the HIA process to the Southside recycling permit application.
Thanks, Makara. This is Melissa with CDPH, and good evening, everyone. So now that Kate has gone over a little bit of what a health impact assessment is we're going to discuss how we are going to be using that methodology to inform the permit decision for this around this facility. Next slide, please. So I feel like it's safe to say that most people on this call are well aware of the facility we're talking, or the proposed facility we're talking about. I do, just in case to level set, want to just describe what it is we're talking about. So Reserve Management Group, or RMG, is an Ohio-based metal recycling company. They have been operating in the 10th Ward for many years. Back in 2019, RMG purchased General Iron, the metal recycler that was then operating in Lincoln Park, and is seeking a permit to move various assets from General Iron to a new facility, Southside Recycling, which would be located at 11600 South Burley, putting it in PMD 6 and the Calumet Industrial Corridor. They are proposing to accept scrap metal, including end-of-life vehicles, for processing and recycling. Next slide, please. So CDPH is just one of the decision makers involved when it comes to establishing a new facility, such as this one, somewhere in the city. So when it comes to approving land uses and the siting of a facility, that's under the purview of the Department of Planning and Development and the Zoning Board of Appeals. When it comes to construction, renovation, demolition, occupancy of a building, those approvals come through the Department of Buildings. And then US EPA and Illinois EPA set emission standards for facilities and enforce those standards, IEPA issuing state permits and enforcing through those state permits. So at this point, the company has approval from those other decision makers, with the exception of CDPH. Before the company would be able to operate, they would need 2 permits from CDPH, an air pollution control permit and a large recycling facility permit. So the intent of these permits is to ensure that the proposed equipment to be used and the operations on the site would be appropriate and within the requirements of our various ordinances and rules and regulations. As part of our department's oversight duties, we have a responsibility to ensure that permits meet all requirements, to actively enforce the standards of those environmental permits and our ordinances and rules, and then to further strengthen our environmental rules. There are some limits to that authority. We are not able to undo decisions made by other decision makers. We are subject to the current local, state, and federal standards and emission levels and other requirements. And we have a duty to apply rules and regulations fairly across similarly situated businesses. Next slide, please. In 2020, CDPH put out new strong rules for large recycling facilities. So large recycling facilities are those that accept over 1,000 tons of recyclable materials a day, or that process and shred vehicles. So these would apply to the proposed operations on this site. The rules incorporate extensive stakeholder input and have strong requirements that are with an aim to limit the impact of such facilities and their impact on the surrounding community. Next slide. So this is just to show that it's been a long time coming, getting here. We have had, as you can see on this timeline, the yellow dots represent various opportunities throughout the permitting process for public input. We've had several public meetings, as well as an opportunity to receive written comments. And you can also see the various points in time at which other decision makers have weighed in on this facility. And sort of the future involves further engagement opportunities, a final HIA report, and then ultimately the final decision of the department regarding the permit. Next slide, please. So all that's to say that we would be remiss if we didn't acknowledge all of the work and input that has already gone into this permitting process to date. So we have all of the air modeling data from both the IEPA and CDPH permitting processes, permit documents, supplemental materials. We've heard from many of you through those public meetings that I mentioned and the opportunities for written comments. And I should mention that those materials, the permit documents, the written comments are available on our dedicated website, which we'll definitely share later in the presentation, and hope maybe the host can drop that link into the chat. What we really want to emphasize is we're not starting from scratch here. We've heard everything that you have said and are incorporating that into our analysis, but this is also an opportunity that we want to hear more from you, get additional feedback on how we're applying the HIA methodology and health equity and environmental justice lens into this process. And with that, I'll turn it over to Megan.
Thanks very much, Melissa. So far tonight, you've learned a bit about what a health impact assessment process is, how it works, why it matters. And then you've heard from Melissa about some background on the Southside Recycling Permit application and the extensive process that led us to today. I hope now that we can transition to talk more about actions, because I know that many of you on this call have been involved in various stages of the permitting review process to date. And what you want to know is, what are we actually going to do about all of this information that we have received? So let's talk about the HIA elements that we're actually going to cover in today's session and some of the work that lies ahead. Next slide, please. I want to note that although up until this point we've been talking in public health terms and using formal language, that we recognize that at the core of this work are people's livelihoods and people's lives. And there are many people on the call who feel passionately about this. So although we are using a formal process and we're going to continue to talk about that formal process, we want to continue to be informed by all of the input that you are providing today in this session, as well as what you have provided up to this point. So here's a bit of the process of an HIA and how we're applying it to the RMG Southside Recycling Permit. Step one is called screening, and that's where we determine whether an HIA is needed or valuable to inform, in this case, our permitting decision. Step two is actually scoping what are the community burdens and the community benefits that we will be considering and analyzing through an assessment process. And then that is step three, where we review the current environmental health and quality of life conditions on the southeast side. And then we actually compare these conditions to the city overall, and importantly to Lincoln Park, which is the location where these recycling facility assets were previously operated. Next slide. So let's start with the screening step. To determine whether an HIA is needed or valuable, we have to answer some key questions about the decision target, who is involved, the timeline, and how the HIA will be used. So CDPH wants to be very upfront with you about the way in which we applied the screening step. So the decision target here is the RMG Southside Recycling Permit application. The HIA is warranted in this case because we have heard significant environmental justice and equity concerns about CDPH's review and evaluation of this permit. CDPH is ultimately the decision maker. It is our choice and our determination based on all of these factors whether to issue a large recycling facility permit that would allow Southside Recycling to operate. That, of course, builds on decisions that were made previously related to zoning, buildings, and emissions, as Melissa previously mentioned. Who is involved is both CDPH and our colleagues at the US EPA, who are represented here today, local stakeholders, which is all of you, and other public agencies that have decision-making authority that is related to the operation of the site. We are committing to making a decision by January of, this slide has a typo, it should be 2022. And the HIA will be used to assess the environmental health and quality of life impacts on the surrounding community, and ultimately to make recommendations on the permitting decision. But importantly, as I said before, all of the work that we do together here will also be used to inform longer-term actions that the city can take to reform policies and practices to fundamentally reevaluate and assess how we consider health, social, and environmental factors in not just CDPH permitting decisions, but overall. So in sum, CDPH has determined that an HIA is needed and it is valuable in this case to inform our decision making. So we move on now to step 2, which is scoping. In step 2, we try to identify what the potential impacts are of the proposed facility, and because we care about the equity principles here, we also are looking at for whom. And this relates to a question that was asked earlier in the evening about how we're scoping the communities that are being most directly impacted by Southside Recycling's proposed operations. We have determined that East Side, Hegewisch, and South Deering, those community areas that are most proximate to the operations of the RMG sort of campus and complex, are the communities most impacted. These are the communities that would experience changes in things like truck traffic and potentially those who would see some of the infrastructure improvements from the work as well. However, as we've discussed previously, we will also be looking at comparator community areas like Lincoln Park as part of this analysis. And we welcome, the inclusion of people who represent other areas across the city of Chicago who have interest in this work as it relates to some of these broader policy questions. The key stakeholders then are people who live and work in these communities. And the questions that the HIA will answer are, what are the current conditions on the Southeast side today before any sort of permit decision? What are the potential impacts on environment, health, quality of life, and equity? So a whole multiplicity of factors that would be triggered by the proposed operations. We look at both positive and negative impacts in this section. We're also going to ask about who benefits, who is burdened, and then to think about what are the ways in which our actions would minimize burdens and maximize benefits. We'll also talk, as I've stated, about ways to improve city policies, process, and practice. Next slide, please. So we do want to spend a moment talking about the ways in which we are centering environmental justice and racial equity in this work. As I've stated, as a department, CDPH has made the promotion of health and racial equity part of our core mission. And these values really do inform and guide everything that we do. We're working together with Chicago's most vulnerable communities to fight the COVID-19 pandemic. Earlier this year, our department stood with Mayor Lightfoot to declare racism as a public health crisis in the city of Chicago. And as discussed, we committed with Healthy Chicago 2025, that community citywide health improvement plan to close Chicago's racial life expectancy gap. And now we're trying to be just as intentional in our efforts to bring those values into our environmental permitting processes. As many of you on the call well know, environmental justice means that no group of people should bear a disproportionate burden of pollution, and people should have an opportunity to participate in and influence decisions that affect the environment and affect their health. So here are just a few ways that we're trying through this process to really center environmental justice and equity. We are committing to being explicit about comparing conditions on the Southeast side to other non-environmental justice community areas. We're committed to facilitated, culturally and linguistic responsive engagement. We do have a Spanish language interpreter here with us today. We're translating our materials. We also are really thankful for the support from Hummingbird Firm, our professional facilitators who are helping to ensure these meetings are thoughtful and productive. We're committing to being transparent about the methods. All of the data, all of the related materials will be posted online, and we are sharing that link with you at the end of this section. And our assessment is going to explicitly address the racial equity considerations that we have heard throughout the permitting process. Next slide, please. So I think there may be a common misperception that the HIA is starting today. In fact, since even before the first community town hall we held in July of last year, CDPH has been working hard to understand and evaluate the potential health and the potential environmental impacts of the proposed Southside recycling operation. And all of this work is going to go into and become part of the health impact assessment. So that includes the permit application materials. It includes all of the expert guidance that we've received from the EPA, as well as their own air quality report, which we'll speak to a bit later tonight. And you all have been a critical part of this process already. So through the 2 community town halls and with 4,000 public comments, you have been giving voice to a whole broad range of potential impacts, both positive and negative. And you are going to continue to be a critical part of that process. These HIA engagement sessions then are just one important part of this 1.5-year-long effort that we've been embarked on to hear feedback from stakeholders, from community residents to environmental advocates to local elected officials and business owners on this application. And we'll also be conducting even more targeted then modeling and analysis in response to the impacts that are of greatest interest to you. And we'll be talking about more on that soon. Next slide, please. So this is a busy slide, but it's an important one, and it's a place where I want to just pause for a moment. And I want to acknowledge that many of you have been really actively and passionately and effectively organizing through social media and through news outlets, in addition to the comments that you have provided to the Department of Public Health directly. And I know that whether you support this permit or whether you oppose it, that this process has come at a cost, and that the question of this permit has caused real pain for many people on the call today. And we recognize that it's about your livelihoods and, as I've said, about your lives. And we take our responsibility very seriously to hear and to honor all of your voices in this HIA, not by just showing our appreciation for your participation, but by being directly responsive and taking action based on the issues that you're raising for us here. Next slide, please. So what are some of the impacts that we have heard already based on this extensive input that you have provided? And to really kind of start to get specific about that, in this step 2 of scoping, we are going to begin connecting those potential impacts that you have raised, whether positive or negative, to short and long-term outcomes. And then ultimately, at the core of the HIA, it's about connecting them back to health. And part of our job then is to assess and to help everyone understand the magnitude of the risks that this operation would present, as well as the extent of any potential benefits. Next slide. So here is just one example of a scoping pathway. One of the concerns that we have heard in the instance of this permit is the potential for an increase in truck traffic. So that would be the short-term outcome. Longer-term outcomes that come from truck traffic would be a change in air quality, a degradation of air quality because of exposure to diesel. Although in the case of the Southside recycling application, there is also some potential benefit that is being raised by infrastructure improvements like paving roads that could actually reduce some of the dust. Another consequence of truck traffic could be crashes, damages to cars and homes. And so then we map that onto the health outcomes, like increasing, we know that increased exposure to air pollution can increase respiratory disease or cardiovascular disease. It impacts poor child health and cancer incidence or neurological issues, increases injuries. Again, part of our job is to help calibrate how much additional incremental risk. In some cases, it may be very minor. In some cases, it may be quite significant. And we are going to be transparent about what we learn through our assessments about those relative risks and benefits. Okay, next slide, please. So this is just the full scoping pathway that CDPH has begun to create based on all of this input we have received already to date. We are now going to come back to the initial question that you got a preview of at the top of today's session. We're really interested in hearing more from you about, we've heard so many potential impacts of this proposed facility, both good and bad. We wonder from the people on the call, which of these impacts are most important to you? And if we're missing anything, what might we be missing? So I'm going to turn it over to Makara to see if we can spend a little bit of time going over those questions. On this slide, we've tried to consolidate from, across all of these inputs, some of the most major impacts that we've heard so far. So this is not everything, but it is an important and I think reasonable sample of what we've heard and what we would propose to be including in scope for our health impact assessment.
Thank you. Sure. Thank you, Megan. And obviously the most robust conversation that's going on right now is actually in this chat, and everything that's been raised in the chats and being elevated. Obviously, we cannot cover in a poll. Someone is asking for us to repost the last slide. So, Nosa, can you just bring down the poll really quickly so Malia can see the last slide?
Yeah, and I'll just speak to that for one more moment because I know that is a busy and complicated slide. We will be sharing that along with all of our materials from tonight so that folks have an opportunity to go through it in more detail. We can also revisit it at a future session. Here, we're mostly just previewing it as a way to say that there are many impacts that we've heard and that the pathways for impact to actually result in change to health are, complicated and sometimes point in various directions. So we're happy to share it, but I would suggest anyone who really wants to go deeper on it that we'll be making all of those materials available after the meeting too.
So I think mostly everyone has participated in the last question. Which of the impacts are most important to you? And it seems like the impact of most concern is pollution overall, air, water, soil, in any sources. The second highest concern is community voice and power. Our goal is for the format of our next meeting to be in the Zoom meeting format where you can see everybody's screen. So I know that even this webinar format may not completely reflect the goal of wanting to make sure that we elevate community voice and power. And then I would say no noise and odors and truck traffic are together there, and jobs and opportunity. And again, this is not a comprehensive list. If you compare it to the slide that's still up, this is pretty consolidated. But thank you to everyone who has participated in that last poll. I also want to ensure everyone that, we will capture this chat. Any questions that were put in the chat and not just in the Q&A will be read so that they can be responded to. So, keep talking, keep sharing your opinions, your thoughts, your concerns, your critiques, because they will be read.
And Megan, we're just going to elevate maybe 2 to 3 questions in the Q&A quickly before we go to the next section, particularly pertaining to this HIA section that you and Melissa has just covered. So one question asked, how long will the HIA take to complete and when did it start? So you did talk a little bit about when it started, but how long will it take to complete?
Yeah, so as we've shared, all of the work that we have been doing to date on analyzing and understanding the potential environmental and health effects of the proposed permit, that work started really even in summer of last year. But we are committing to actually making a decision and publishing and working with you on disseminating the findings of the HIA by January of this coming year, 2022.
Okay, thank you.
No, so the next question you're going to read, can you allow whoever posted the question to read it in their own voice? There are just some concerns in the chat that we're not hearing enough community voices. And so I want them to be able to read their question themselves.
Okay. So Jordan Henderson, if you would like to read your chat, if you would like to read your question out loud, just raise your hand and I will be able to elevate you to answer, and then you can get your question asked. I'm going to see if Jordan. Okay. Marcel Ritchie. if you would like to say your question out loud, just put your hand up in the chat, in the participant section, and I can elevate your voice. Okay, Marcel has raised his hand, or their hand, so I will allow to talk.
Hello, are you able to hear me?
Yep.
So I do have a couple of questions. My first is, here in the East Side, at least, I know specifically we have a lot of undocumented families here. How are they going to be able to access or get an initial health assessment? Will the Cook County Health, be able to provide something like that? And how will they be able to get continued screenings? And especially, again, for those within a closer impact of the radius of this facility. And then where will the HIA assessments be provided and how often? We want to be informed, especially of what's going on, especially to the air quality. And so we can be more of a proactive instead of a reactive type of situation. So where will these assessments be posted? Where will the air quality be posted, or like all these assessments? Yeah. How often will they be done? And also, will there be Spanish provided people for all of these things I'm mentioning? Thank you.
Great. Thanks, Marcel. Did you get all three of those questions, Megan?
I'll do my best. You can help me make sure that I'm remembering and responding to each kind of component part there. So the health impact assessment that we're doing on Southside Recycling looks at the proposed permitting decision. So as we talked about in that kind of screening section, all of the intention of the work that we're doing right now is to help inform the decision on the permit. So that is a one-time process, but all of that material that we generate, everything that we create here, that talks about the components of the assessment or our methods or the data that we're using, all of that is being posted. We started this even now on a city website. And I would hope that maybe one of my colleagues could pop that into the chat box just so that folks see it. We'll feature that a little bit later with a link and a slide too. So we are trying to be very transparent and to make that readily available. We are making efforts also to have materials and sessions translated into Spanish to ensure accessibility. As far as individual health screenings or health assessments, at this time, that is not in scope for this particular health impact assessment process. That is a sort of different individual exercise. I think what I can say about that, what I hear in that question is a concern about pollution exposure risks and the impact that could have on people's health if Southside Recycling were to move forward. And I think at the core of that question is where it's important for CDPH and for the US EPA to share data with you all about what are the actual, incremental, potential additional, what are the baseline conditions, what is air quality on the southeast side today, and what potential additional exposure would the proposed Southside recycling operation present. And so that is in scope for us. We will talk about impact on individual level health, but at this stage, we're not. That is not about provision of individual health screenings. It's about looking at population health risks. Did I address all the parts of the question, Makara?
Marcel, I feel like there was one more question. How to get access to the data?
Oh yeah, so we'll put that in the chat box, but it will be publicly available. And I did want to say that one element of health impact assessment that we'll go more into in a subsequent meeting is about monitoring and evaluation. So whatever the decision is on the permit part of the HIA, we'll talk about the commitments that we are recommending for ongoing monitoring and ongoing evaluation of the company's operations, and that there would be ways in which we would be regularly monitoring to ensure that there is not exposure if that is of concern.
And one more question, or the last part, I guess, is so who will you be working with? Will it be in conjunction with Illinois EPA or EPA itself?
So most sort of intimately involved in this process with us are our colleagues from the United States EPA, and particularly their Region 5 office. We're thankful to have them here with us today. We are also in touch with the Illinois EPA, and we recognize that this work demands a sort of whole of government approach. So we are committed to working not just across city departments, but in collaboration with other public agencies like the IEPA as well.
Thank you, Megan. Let's go ahead and move to the next step in the meeting for the evening.
Okay. I'm going to
All right.
the poll and then move on. So give me 1 second.
You said you're sharing results of the poll?
I stopped sharing. I'm stopping sharing results. Yeah.
Okay.
We're gonna move on.
I couldn't see it. And so while Nosa's bringing the presentation up again, and we are going to have Megan as well as Katie Siegel and Kirsty Blasky speak next. I just want to remind folks that are communicating in the chat of our ground rules here to make sure that we, we're respectful to each other. I know we have divergent opinions and they're very strong, but just be mindful. We're all adults here. At least I think we all are. Just be mindful of that. All right.
Okay, so we're going to segue now into discussion of current conditions on the southeast side. So this takes us into that third step of the HIA process, this assessment step, where part one, which we'll go through today, is we're going to talk about current baseline conditions. And part two is going to actually be looking at the evaluation of potential impacts of the proposed southeast side recycling facility. So in a moment, we're going to start, really kind of digging into numbers. And some of this may be difficult to see so starkly because we know that at its core, although we're talking in a language of data today, that these numbers do represent lives, and really for many of you, your lives. So we also want to say that the information we're sharing today is just a snapshot, and we acknowledge that it is part of a much bigger picture of life on the southeast side of Chicago. So next slide, please. And I think that this was really powerfully conveyed in a recent Washington Post article in which I believe some of the attendees in today's session were profiled. So I encourage anyone who's not read it to take a moment to review that article. And it really broadly characterizes and centers some of the concerns that people are raising in the chat about racial equity, about lack of voice, lack of community power. So we are intentional in our assessment process in ensuring that we aren't just looking at numbers, we are also bringing in voices from these and many other sources. So with that, I will turn things over to Katie Siegel, my colleague from the US EPA, and invite her to share some more information on the US EPA's recent air analysis for the Southeast.
Thank you, Megan. Hi, everyone. My name is Katie Siegel. I work for the United States Environmental Protection Agency here in Region 5. I am the manager of our air monitoring and air toxics branch. I'm really grateful to be here tonight and be part of this meeting. I am a proud Chicago native. Growing up, my basketball team was in the same league as Annunciata, and I have fond memories of playing basketball in the gym there, not too far from the proposed site. Next slide, please. I'm here to give a high-level overview of the recently released EPA report. It was reported on October 21st of this year, and if you haven't read it yet, I encourage everyone to take a look, and we're going to put a link to the report in the chat. EPA began this analysis in April of this year. And we began this analysis because we really wanted to take a data-driven approach to understand air trends in this community. And we're very fortunate in that a gold standard regulatory monitoring site operates at George Washington High School. And this monitoring site collects particulate matter, which is sometimes known as PM or soot. And it measures two different types of particulate matter. It measures smaller particles known as fine PM or PM 2.5 and larger particles known as coarse PM or PM 10. At this monitoring site, it also measures metals like lead and manganese. And we care about these pollutants because they can have health effects. PM is emitted from sources like smokestacks and construction sites. And EPA studies, scientific studies show that it can have health impacts, especially for the most vulnerable members of our communities, like the young, like the elderly, and those with pre-existing heart and lung conditions. We also care about metals like lead and manganese because they too can have health impacts. For instance, lead has been documented to have cognitive impacts in young children. So another point I want to highlight is that this report is just one input into the city's health impact assessment. A main reason for this is because monitoring data has its limitations, and our report goes into more detail about that. As you'll hear from the other presenters, the city's report is going to look at a plethora of data, including data about population vulnerability. And I look forward to hearing more from Kirsty after I present on this topic. So next, I want to turn to the key findings. And, we wanted to look at how concentrations of monitored pollutants have changed at George Washington High School over time. So we looked at a 10-year snapshot and a 3-year snapshot. And over the past 10 years, pollutants measured at George Washington High School have either decreased or remained the same. When we zoom in for the last 3 years, the same is true, except for coarse particulate matter or PM10. We have seen an uptick in PM10, and I want to assure you that our agency is partnering with other agencies to investigate this and find out why that is happening. Turning to metals, over the past 10 years, annual averages of all metals have been below the long-term health benchmarks for that metal. I want to spend a moment to walk through how to interpret the chart on this slide. There are several charts like this in our report, so I think it's worth just taking a moment to walk through it. So each blue dot represents an individual PM 2.5 observation that has been collected each day over the past 10 years at George Washington High School. The orange dotted line is the trend line for these past 10 years. And as you can see, the trend is decreasing. The green line represents EPA's national standard for PM 2.5. And as you can see, the trend line is below the green line for PM 2.5. Next slide, please. So you may be wondering how values measured at George Washington High School compared to other parts of the city. So we looked at where we had other operating monitors and made a comparison. So when we look at short-term or daily values of fine particulate matter, Southeast Chicago is tied for the highest. When we look at longer-term or annual values of fine particulate matter, Southeast Chicago is in the middle. It is the 6th highest out of 12. And when we look at longer-term or annual values of coarse particulate matter, or PM10, Southeast Chicago is also in the middle. It is the 2nd highest out of 3. I also want to talk about some special monitoring that EPA required, not at George Washington High School, but at facilities that handle manganese. The most recent 12-month rolling averages of manganese near these facilities are all below the long-term health benchmark. These reductions in manganese pollution are a result of EPA enforcement efforts and the city's bulk handling ordinance. And we are continuing these efforts. Since this spring, my counterparts in the air enforcement program have conducted over 60 inspections in Chicago, focusing on the South Side. There is no other neighborhood in the Midwest where this level of effort has occurred. And going forward, we invite community advocates to give us additional feedback on where else we should inspect. Next slide, please. So I just want to wrap up and leave you with a few key takeaways. The first is that EPA's report uses a data-driven approach to understand trends in the community. While it is neither a cumulative impact analysis or a disparate impact analysis, it is still a very important piece into the city's HIA. If you haven't read the report yet, I encourage you to find the link in the chat and check it out. And last but not least, EPA will continue to engage with the community and partners on improving air quality on the Southeast side. While much progress has been made, EPA recognizes that there's still more work to be done. And that's why we've been conducting these inspections. And that's why we want to hear from you about where else we should inspect. So with that, I'd like to introduce Kirsty. She's going to talk about additional environmental data that the city is looking at, and then we'll take questions after that. Thank you.
Okay, before Kirsty comes on, we just wanted to elevate some questions that were asked in the chat. So I know there was a particular question asked by Mila. So Mila, if you would like to say your question out loud so that Katie may be able to answer it, you could just raise your hand and I will elevate you to speak. Perfect. I see your hand.
Thank you. And this is Malia Gertzma. Again, I have a Master's of Public Health from Harvard in environmental public health. I just wanted to note my extreme disappointment that Catherine Siegel's presentation did not include much, if any, recitation of all of the limitations and the contextualizing that US EPA included at the beginning of the report in the narrative that's provided. The information would explain that the monitors that we have are extremely limited, that they only measure air quality in certain communities where we expect air quality to be the worst in the city. It also did not express anything about the fact that this report does not look at actual health impacts because it does not gauge the combined impact of being exposed to all of these pollutants at once. Nor does it acknowledge that US EPA itself has committed to revising its own national standards for particulate matter, and that many bodies, as some of my colleagues may address too, have already adopted standards that are far more stringent than what US EPA is using. And if the US actually adopted these standards and along with the rest of the world, that there would already be a number of exceedances on the Southeast side. So I think it's extraordinarily important to put this report in context for what it is and for what it isn't. I also wanted to state that the report on its face says that this community has the highest daily fine particle pollution in the city. I also wanted to note that the metals are increasing, PM10 is increasing, when the overall trends for other places are that these pollutants are going down. And that, from what we can tell, that upward trend is reversing some of those benefits that Katie just talked about from US EPA enforcement and the city's activities. So you are bringing the pollution down only to let more pollution be emitted. Lastly, I wanted to make a couple points of what's not in the report, but is evident from the monitors, which is that based on preliminary data that US EPA itself has provided to me, the South Water Treatment Plant ozone monitor has the highest ozone levels for the first time in, I think, ever, out of all the reports, the ozone monitors in the region. And if US EPA had actually compared the PM10 levels and included those at monitors in Northwest Indiana, a heavily industrialized area, the Washington High School monitor, which would be consistently in the top 3 monitors out of 8, only being up there with McCook, which is a very dusty facility, and Bethlehem's steel plant for comparison. So again, I'm very disappointed with this presentation. The report as a whole made some of these contextualizing comments at the beginning. None of that was presented in this presentation. And I think, again, what we need to acknowledge is that the pollution levels in this community almost across the board are some of the highest in Chicago. And if the CDPH is going to comply with its civil rights obligations to address pollution disparities, we have to be honest about that. We have to acknowledge it, and we have to address it. Thank you.
Thank you, Malia.
Okay, if anyone else would like to,
Did anyone on the team want to address any of Malia's concern before we take the next question? Or do you want to wait to hold to respond towards the end of the presentation?
I can speak to one point Malia brought up. She's right that the report does go into more detail about the limitations of monitoring data. I think the most obvious limitation is that, the George Washington High School site only monitors for certain pollutants. As I described, it measures for particulate matter and metals. It does not measure volatile organic carbons, for instance. And, she hit on it, that we can only make comparisons where we have existing operating monitors. So that's an obvious limitation, and that is described in more detail in the report.
Nosa, can you elevate Mark Banks to speak, please?
I'm elevating him right now. Mark Banks, you can now speak. Perfect.
Hi, can you hear me?
Yes.
Yes.
Okay, thank you. I was waiting for quite a while there to comment, but anyway, I just want to say, well, first of all, I'm in full agreement with what was said just now, and with a lot of the other statements that were made by community members, both verbally and in the chat. So I want to express solidarity there. But I do also want to, I really wanted to do this very early on in the discussion, but now it kind of is a different place. But one thing I don't like about these meetings, and I want to make this explicit out loud for the record, is that you really set the tone with these discussions, especially in the way that you do a lot of talking, and then we only get to respond to sort of topics that you design. The idea, in my opinion, the idea that the place we're all at in the big picture of all this is trying to figure out some bare minimum of, minimum/maximum of allowable pollution, to see if you can flip it through politically and make a bunch of money after you just got embarrassed off of the north side by the gentrifiers up there. The pseudoscience you guys are doing and the pseudo-democracy you're doing. This is not where we're at. Where we're at is the age of climate collapse and ecocide driven by industrial capitalism. And our community needs a lot of other things besides more in industry. We need reparations for the, decades and generations of abuse that we've already suffered, the cancers, the tumors, the respiratory illnesses. We need land remediation. We need something on the order and, unprecedented scope on the order of when the national parks were created. The South Side needs to become a massive preserve. We need to get jobs that have to do with experimental conservation and remediation, not all this other crap, not recycling and all that. So, I appreciate the conversation on the studies and what does this assessment do and all that, but it's honestly a bunch of nonsense. It's a deflection from what we should be talking about, and that's what I wanted to say.
Mark, thank you for sharing your perspective and your thoughts.
I appreciate that. And On behalf of the Chicago Department of Public Health, I can say that what I hear in those comments is this profound sense of urgency around more fundamental change and action. And I can tell you that that is part of the commitment of Healthy Chicago 2025 is to bring public health perspectives and public health data and public health partnerships into spaces where we can help to drive that more fundamental change. We can talk if people on the call are interested in some of the investments that the City of Chicago is making through the American Rescue Plan, ARP, in its 2022 budget and ways in which we are deepening our commitment to addressing climate justice. Angela Tovar, our Chief Sustainability Officer, has worked with many of you on those initiatives, and we look forward to continued partnership. But I certainly take the point that this HIA and even this decision, this narrow decision on the southeast side, this permit application for south side recycling is just a symptom of a much broader question that the city is facing, that our communities are facing around environmental justice. So we hear that, and we are approaching this HIA in that spirit as well.
Thank you, Megan. Let's have Kirsty go ahead and talk about the next section in the presentation.
Hi, good evening. I'm Kirsty Bosque. I'm an epidemiologist with the Chicago Department of Public Health. And our HIA is intended to consider potential environmental, health, and quality of life impacts on the southeast side of Chicago. CDPH leveraged existing data sources to analyze population health status and baseline conditions in the east side, Hegewisch and South Deering, the community areas of focus on the southeast side, and Lincoln Park and Chicago as comparisons. In particular, we drew upon data available from the US Census, EPA, CDC, Illinois Department of Public Health, and CDPH. Today, we'll present some of the data we are exploring as part of the HIA. We started out by building on EPA's air quality report by including what we are calling other environmental indicators, things like land use, traffic, geographic proximity to polluting sites, lifetime risk of health effects due to hazardous air pollutants. We'll focus our discussion on health with measures of cancer, cardiovascular, and respiratory disease. For quality of life, we considered life expectancy and self-reported measures of physical and mental health. Lastly, we'll review the social factors that impact a community's vulnerability to environmental stressors by exploring the Social Vulnerability Index, race, ethnicity, language, socioeconomic factors, and access to care. First, let's orient you to the data visualization we'll be using on the next few slides. Each of the indicators is displayed as a dot plot, with each dot representing Lincoln Park in teal, East Side in dark green, Hegewisch in medium green, and South Deering in light green. Chicago is represented by the blue dot. The actual number is labeled within or near the dot, and the type of measure, percent or rate, for example, is reflected in the parentheses after the name of the indicator. The southeast side communities of focus have higher percentages of land use dedicated to industries such as manufacturing, processing, warehousing, distribution, and storage as compared to Lincoln Park and Chicago overall. Currently, there are 408 facilities in Chicago that are significant sources of air pollution. These facilities are permitted by both IEPA and CDPH. Of the community areas of interest in Chicago, South Deering has the highest number with 20 facilities. Motor vehicle traffic is associated with increased exposure to ambient noise, toxic gases, and particulate matter, including diesel particulates. Traffic intensity considers the proximity and the volume of vehicles on major roads. Chicago has the higher levels of traffic than the 4 community areas we are studying. The east side has the highest traffic intensity, and South Deering and Lincoln Park have similar traffic levels. Hegewisch has the lowest traffic levels. The southeast side community areas are closer to more Superfund sites than Lincoln Park, though Lincoln Park is closer to more hazardous waste sites. Superfund sites are either proposed or listed in the national priority list and are abandoned and contaminated by hazardous waste being dumped, left out in the open, or otherwise improperly managed, and include former manufacturing facilities, processing plants, landfills, and mining sites. Hazardous waste sites are active facilities for the treatment, storage, or disposal of hazardous waste. The substances at these facilities can reach humans in a number of ways, through the air via breathing or through migration into groundwater, eventually making its way into the drinking water. The final two environmental indicators are based on data from the National Air Toxics Assessment, which estimates potential cancer and non-cancer health effects based on inhalation of air toxics or breathing in hazardous air pollutants. Most air toxics originate from transportation and industry, including motor vehicles, industrial facilities, and power plants. The Respiratory Hazard Index tells us the risk of adverse respiratory health effects from breathing air toxics over a lifetime or 70 years. No adverse health effects are expected if the measure is less than 1. None of the community areas or Chicago exceed 1, meaning air toxics are unlikely to cause adverse respiratory health effects over a lifetime of exposure. Lifetime cancer risk is the probability of developing cancer over the course of a lifetime, assuming exposure to hazardous air pollutants 24 hours a day for 70 years. Lifetime cancer risk from inhalation of air toxics is highest in Lincoln Park compared to the Southeast Side community areas and Chicago overall. However, for reference, the National Emissions Standard for Hazardous Pollutants rule sets an upper limit of acceptable risk at about 1 in 10,000 or 100 in 1 million. Neither Chicago nor any of the community areas of focus exceed this standard. Compared to Lincoln Park, the Southeast Side community areas have more industry, are closer to Superfund sites, and have a less lifetime risk of health effects due to hazardous air pollutants. Let's pause here and take some questions about any of the environmental data Katie and I have just shared with you.
Okay, there's a question in the Q&A by Kiana. If you would like to say your question out loud, just raise your hand, and then we have some raised hands in the participant side. So I'm going to Kiana, okay. I'm going to allow Kiana to talk. All right, Kiana, once you unmute yourself, you'll be able to hear you.
Can you hear me?
Yep.
Okay. I just wanted to clarify how wanted to know how this data was gathered and if community members were surveyed about any of these data points or if it just came from EJ Screen.
They just came from EJ Screen. The data, the last 4, the ones on the bottom 4 came from EJ Screen. The top one came from the Chicago Metropolitan Agency for Planning, CMAP, from their land use, and that is from 2015. And then the data about the facilities came from CDPH's own, the City of Chicago data portal that we support through our environmental permitting and inspections program.
Okay, there's actually a question from a resident, so I'm going to allow Robert to speak. So I will allow.
Is that Robert ECKES? Okay, great. Thank you.
Yes.
Yes.
Thanks very much. These are thoughtful and important questions. And again, there was a lot in there. So I hope others can help make sure I'm touching on all of the elements. So the latter part of your question was about the fact that RMG manages, owns, operates several facilities on the southeast side of Chicago campus where they have proposed to operate Southside recycling. We are looking, and my colleague Renante Morante will talk more about how our assessment is looking at the cumulative impacts of all of those operations as part of our health impact assessment, as well as looking at some other nearby developments like the North Point warehouse. So all of that is being taken into consideration to ensure that there isn't any way that these various facilities are using different sort of permit processes to circumvent our complete analysis of air quality and any potential impacts. To the first part of your point, I understand. I understand. Okay. So I hear that feedback. I'm not sure, Renante, whether there's anything that you would like to share on that point, or if that's something that we would further evaluate and come back to as part of our written responses to questions from tonight's session.
Yeah, we did look at that. As far as there's 4 like distinct facilities there, they are for the most part independent of each other as far as permitting. We did look at that, and then we are considering basically grouping them as one air permit under our air program. However, in the recycling permit, we don't have those provisions. We are making sure that they're not accepting like waste or operations from each other. They're allowed to bring material from one site to another site as long as they're doing it like they would do any other kind of recyclable materials. And as you said, we are looking at basically the totality of the impacts from the property, not just from individual ones. And I just want to remind, this is more a recycling permit. So there's not really kind of emission standards. We do have, monitoring requirements. So we want to make sure that, they're not exceeding the EPA national ambient standards. The permit I am reviewing is the large recycling facility permit. So it's a recycling permit. But we are evaluating the air emissions and health risks and hazards from the whole property. We do this, as I mentioned, that we'll probably move in sync with the Illinois EPA. I understand from the Illinois EPA, they're moving to basically permit the facility as 1 or 2 sources. And once that happens, we'll probably follow suit with our air permitting as well. I can't speak for the air permit since I'm not in that group, but I only speak for the recycling permit. Yeah, I can't speak to the standards, but as far as the health impact assessment we're doing here, we are modeling, we are looking at the total carcinogenic effects, the cumulative carcinogenic effects from the pollutants that we're looking into, as well as the hazard, the non-carcinogenic hazards based on of certain chemicals. And also we'll be looking at basically comparing the air modeling to national ambient air quality standards, to current ambient air quality standards. Yes. Yes, I'm sorry to cut you off. Yes, I will give a preview to that in my portion of the presentation tonight. But a lot of that, I think, will be dedicated. A lot of the going over the health risk assessment, the computer modeling. A lot of that will happen in the next meeting.
All right, we're going to let Yesenia ask her question, and then Arante is going to go more into the data and hopefully answer some of those outstanding questions. Yesenia?
Hi, can you all hear me?
Yes.
Okay, thank you. So my question is actually about the data that was just presented. I would like to understand why the source of the data presented, like the actual sources of the particulate matter emissions, was excluded from the report, if that information is actually publicly available in the IEPA report you all use for reference. Secondly, that's a huge concern to the validity and the transparency of this attempt of a health impact assessment. For multiple reasons. One being, like, it's obviously important to know the sources of the emissions, because we have a company currently that's on this call trying to propose a mining project, and they're disguising it as a drilling operation. And then additionally, we have more concrete processing operations that are trying to come into the neighborhood. So I would just like to understand why that is missing from the report. If I can get an answer, that would be great.
Megan, who should address that question?
Kirsty, I believe that was about data sources and a description of some of the methods. Or is that something you're able to speak to, or shall we follow up after the session?
I guess I'm not clear what's missing from the data sources.
What's missing is where the actual particulate matter is coming from. So the IEPA report, if you scroll down from the pages where they actually have the graphs, like the 2008 report, the 2018 report, and the 2019 report, if you go towards the end of it, it actually shows you where the majority of the emissions are coming from, and it breaks it down for you. Why is it not included in this report?
I'm not sure of the report that you're talking about. And what you mean by where the particulate matter is coming from in reference to what measure are you talking about?
Where, like, literally what's emitting the particulate matter? Like, is it mining? Is it industrial? Is it commercial? Is it electric generation? That's all publicly available.
Right. I agree with you. Yeah. So I will say that, this is just an excerpt of what will be part of the overall HIA report. And, we only are presenting, some of the data tonight because of time constraints. And so, all of that information will be considered in the full report.
That doesn't make sense. If you all had time to consider and make the charts to tell us what particulate matter levels are currently in the neighborhood, then why would you not take the time to actually be accurate and transparent to where these emissions are coming from, other than to protect dirty industry that's already in the neighborhood? I'm sorry, that's unacceptable. That doesn't make sense. Like, this is a scientific report, right? There are steps for that. And this is, like, the validity is just out of the door at this point, because you all aren't even telling us where these emissions are coming from. You're just telling us the levels.
Thank you. We hear the comment about the importance of source apportionment. So although some of that is beyond the scope of this health impact assessment, where we really are looking at just overall contributions to ambient air quality, the work that you're describing is important work for the broader policy efforts that we've been talking about tonight. So when we think about advancing a cumulative impact ordinance in the city of Chicago, when we think about the ways in which we better monitor and enforce pollution standards, that source apportionment is a critical piece. So thank you.
Well, no, I don't need the fluff. Like, it's obviously not critical enough to you all to include it because it's not included. So it's really not beyond the scope. It's just the fact that you all did not include it in this report. It was a matter of a copy and paste because the information was already published. It's not beyond the scope.
We may want to follow up with you offline to better understand some of the concerns and considerations that you're raising. So
you don't need to follow up with me. You just have to be honest as to why it was excluded, because it's already there. There's no need to follow up.
Okay. Thank you.
So we'll make sure in the communication that we send out to everyone on this call that we have links to some of the full reports that we've just taken excerpts from for this meeting tonight, so that anyone who's interested in diving deeper into the details of some of the data can do that, and which will allow us to have an opportunity to continue this conversation during our next meeting. And I believe somebody did, Robert just put the link to the full report in the chat. So at this time, we're going to have Renate Morante speak about this process and next steps.
I think, we're continuing with Kirsty.
Okay.
Kirsty, let me know when you're ready and I can move along.
Yep, I'm ready right now.
Okay, perfect.
So this slide is looking at overall cancer as well as breast and lung cancer incidence and mortality. Incidence is new cases of cancer. Overall cancer incidence is significantly higher in Lincoln Park compared to South Deering and East Side, while cancer mortality is higher for the Southeast Side community areas compared to Lincoln Park, but not significantly. A similar pattern is seen for breast cancer incidence, though only the difference between Lincoln Park and East Side is statistically significant. Breast cancer mortality is highest for Chicago overall and is not significantly different among the 4 community areas of focus. Rates of lung cancer incidence and mortality are higher for Hegewisch and South Deering compared to Lincoln Park. The East Side community area has the lowest rates of lung cancer incidence and mortality. The discrepancies we see between incidence and mortality rates may have something to do with access to care, so incidence may be higher in Lincoln Park because of better screening and earlier treatment versus later diagnosis and more severe disease, which is less treatable and thus higher mortality. Hypertension, coronary heart disease, and stroke prevalence are significantly higher in South Deering, East Side, and Hegewisch compared to Lincoln Park. Prevalence is existing cases of high blood pressure and heart disease or having suffered a stroke in the past. Coronary heart disease mortality rates are less for all community areas than seen in Chicago overall, though East Side and South Deering have higher rates than Lincoln Park and Hegewisch, though not significantly. Similarly, stroke mortality is less in the community areas of focus compared to Chicago overall. Stroke and heart attack hospitalizations are displayed a bit differently. This data comes to CDPH from the Illinois Department of Public Health and is only available at the zip code level. The 60614 zip code aligns with Lincoln Park, while the 60633 and 60617 zip codes align with the 3 Southeast Side community areas. Hospitalizations due to stroke and heart attack are significantly higher in the Southeast Side, specifically 60617, compared to Lincoln Park or 60614. Next slide, please. Prevalence of asthma and COPD is higher on the Southeast Side compared to Lincoln Park. South Deering has the highest rates of all 4 community areas, but this difference is only significant for COPD. Hegewisch and East Side rates are significantly different from Lincoln Park for both asthma and COPD. COPD mortality is lowest in Lincoln Park. All community areas are less than the rate seen in Chicago overall. Asthma emergency department visits are significantly higher in 60617 compared to 60614, which is Lincoln Park, and COPD emergency department visits and hospitalizations are also significantly higher in 60617 on the Southeast Side compared to 60614. As we end the health data section, I'll note that differences in cancer, cardiovascular, and respiratory disease morbidity and mortality cannot solely be explained by environmental conditions within these community areas. Other factors such as social and economic conditions, access to care, and health behaviors may also play a role. So to sum up, the Southeast Side community areas have higher rates of cardiovascular and respiratory diseases and lower overall cancer incidence, but higher mortality than Lincoln Park. Now we're going to talk about quality of life. Chronic disease is the leading driver of Chicago's 9-year life expectancy gap between Black and white residents and decreases in life expectancy in the Latinx population. Air pollution can both increase risk of chronic illnesses like heart and lung diseases and contribute to worse outcomes for people living with certain health conditions. CDPH chose life expectancy and self-reported measures of overall health, poor physical and mental health, to serve as indicators of quality of life. The concept of health-related quality of life and its determinants has been evolving since the 1980s. Based on scientific literature and advice from its public health partners, CDC has defined it as an individual or group's perceived physical and mental health over time. Overall, Lincoln Park's quality of life measures are better than those in the Southeast Side community areas. Life expectancy is 2.4 to 6.7 years higher in Lincoln Park compared to East Side, Hegewisch, and South Deering. Adults in South Deering, East Side, and Hegewisch have significantly poorer rates of physical and mental health compared to Lincoln Park, while overall health is lower than Lincoln Park, but only significant for Hegewisch. So compared to Lincoln Park, the Southeast Side community areas have shorter life expectancies and worse self-reported health. Let's turn to social factors. Social vulnerability refers to the resilience of communities when confronted by external stressors on human health, either natural or man-made. The Social Vulnerability Index includes measures of socioeconomic status, household composition, minority status and language, housing type, and transportation. The other social factors displayed here are a way to indicate which communities may be more susceptible to a given level of exposure to environmental pollutants. For example, individuals may be more susceptible when they have reduced access to care, lack resources or language skills or education that would help them avoid exposures or obtain treatment. Moreover, according to the EPA, environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. That is why we specifically included people of color, limited English proficiency, and per capita income in this analysis. Of the 4 community areas being studied in this HIA, Lincoln Park is the least socially vulnerable, has the fewest people of color, lowest rates of limited English, and the highest levels of income, education, employment, and insurance coverage. These social factors are each significantly different between Lincoln Park and the 3 community areas on the southeast side. So compared to Lincoln Park, the southeast side community areas are less resilient against the effects of environmental stressors. Let's sum things up. Everything we've just discussed is best summarized in the Air Quality and Health Index developed by CDPH in 2020, which demonstrates the impact of the combination of environmental, health, and social factors on the vulnerability to the effects of air pollution. You can see from the map, South Deering, Hegewisch, and East Side, circled on the bottom right of the slide, are more darkly shaded compared to Lincoln Park in the smaller oval above. The proposed location of the recycling facility is indicated by a star on the map. This map visually demonstrates the increased vulnerability of the southeast side to air pollution compared to Lincoln Park. Now that we've reviewed the data, I want to briefly mention some limitations of the data we talked about this evening. CDPH is utilizing the most recent and available data for this HIA. Most data is current within the last few years, though some environmental data does go back to 2014. Another consideration is small numbers. These community areas sometimes only have a few number of events, such as the annual lung cancer diagnoses. In these cases, we use standard statistical methods and combined years to better analyze trends. To ensure precision and accuracy of the data, CDPH utilized the most accepted sources of data, such as EPA and Census Bureau. For our own analyses, we applied proven statistical methods to measure variation. We'll be sharing a supplemental document with you that links you to all the data sources, and you could read more about these specific data sets on your own. I'll end by reviewing some of our key findings from our analysis of current community conditions in the East Side, Hegewisch, and South Deering community areas. Southeast Side community areas of interest have more industry and facilities with the potential to pollute, as well as closer proximity to Superfund sites, but have less lifetime risk of health effects due to air toxics than Lincoln Park. Cardiovascular and respiratory disease is more prevalent in South Deering, East Side, and Hegewisch compared to Lincoln Park. Overall cancer incidence is higher in Lincoln Park, but cancer mortality is higher in the southeast side community areas. Life expectancy and self-reported health are worse in the southeast side community areas compared to Lincoln Park. Finally, South Deering, East Side, and Hegewisch may be less resilient to the effects of environmental stress than Lincoln Park based on social factors. Thank you for your time and attention.
Thank you, Chair Steve. We're going to go ahead and have Renate speak and then open it up to questions.
Hello, all. My name is Renate Morante. I'm an environmental engineer with the Chicago Department of Public Health. I am the permit reviewer for the Southside Recycling's large recycling facility permit application. As I mentioned before earlier, I'm here to give a brief preview of the health risk assessment part 2 that we are working on with US EPA. This computer modeling analyzes health impacts associated with the operations of the 4 existing recycling facilities on the RMG property and the proposed auto shredding facility. This work greatly expands upon the previous air quality impact analysis performed by RMG that were submitted to IEPA and CDPH. An example of this is that we're extending the analysis to evaluate diesel truck emissions associated with RMG, as well as from the new North Point warehouse just south of the property. The pollutants will be mainly looking at our fine particulates, both PM10 and PM2.5, and metals such as lead and manganese from stationary sources at the property, as well as diesel particulates and nitrogen dioxide from truck exhaust emissions. As you can see here, is the map basically shows the source areas that we're looking at. You can see a large property to the north that's RMG. The small square on just south of it is North Point. It also shows the public street segments in yellow, and the intersections will be evaluating mobile source emissions. We are also adding particulate deposition modeling to investigate indirect exposure of contaminants by ingestion. Contaminants may be ingested through direct contact. For example, when kids are playing on the ground, they could touch the soil and put their hands in their mouth, as well as eating locally grown fruits and vegetables that may have absorbed the deposited particulate matter from the soil. This health risk assessment model is the model we're using is US EPA's Health Risk Assessment Protocol, or HHRAP. This process uses air dispersion and deposition modeling data to estimate the added risks and hazards to human health. Emission sources that will be modeled include both point sources, such as exhaust stacks and the auto shredder, and fugitive dust sources, such as material handling, dust from roads, and stockpiles. Overall, the modeling will assess both long-term and short-term health impacts to children and adult residential populations. We're currently doing emissions inventory and setup of the model, and we hope to provide detailed presentation of this work and hopefully present some early findings in the next meeting. In the meantime, I will turn it over to Makara.
All right. Thank you to everyone, for those who are still here and for listening to what the presenters had to share with you this evening. I know folks are itching to ask questions. There are lots of questions in the Q&A. There are lots of questions in the chat. I want to acknowledge that we are at time for the time that we scheduled for this meeting this evening. We have a cushion, and we can stay longer to answer the questions that have been given. Obviously, we will not get to all of them. So for those of you who choose to stay longer for the Q&A, welcome, and we understand for those of you who may need to leave. All right, so Nosa, I will allow you to elevate the first question.
Okay, so I'm just going through people who have their hands raised and seeing if there are any questions. So Matthew Zed says, You have a question in the Q&A. If you would like to say it out loud, just raise your hand and I'll be able to elevate you so you can ask your question out loud. And Thomas, is Thomas Duda? I really apologize for saying your name wrong. Please correct me if I'm wrong, but also also raise up your hand so I can elevate you and you can say your question out loud. Thomas is a Northside resident. So I want to make sure we capture that, their question.
No, so can you unpin Kirsty so that we're able to see the participant who's asking the question? Thank you.
So far, those two participants haven't raised their hands. So I'm going to see that we have Isis. So I'm going to allow Isis to talk. Isis, talk is permitted. You can speak your question now.
Thank you. So I was just wondering, because the point of this is to hold industries accountable, correct? And hold them responsible to keep a clean environment. Well, how could that be possible when RMG itself at this current moment has dilapidated roofing, has a pollutant just coming out of the roof across the street from a school, they're missing a lot of employees get frostbite because of unsafe work conditions. They have unsafe infrastructure and materials and everything that they use. So how are we supposed to hold Southside Recycling, if you are to permit it, responsible if you aren't even holding RMG responsible at this current moment?
Thank you for that question, Isis. What I think you're kind of getting at is a combination of things here. One part of it is really about the conditions on the campus itself and on the property and risks that might present to workers on the site and others who are in close proximity to the operations. In general, worker safety is the purview of OSHA and their enforcement activities. As far as those things within CDPH's permitting control, part of what we do look at through our permit review process is past violations, and we use those to inform our decision on permits as well as any special conditions that might then apply.
Okay, so if you are using past violations and citations that were given, why was it excluded that under RMG's control of General Iron, there was an explosion of a shredder that they want to move into Southside Recycling? Why was that excluded from the presentation?
Yes, you're referencing an explosion that happened on the General Iron campus during its time of operation in Lincoln Park. CDPH was involved in the review of that explosion and the follow-up actions that were taken by the city of Chicago around enforcement. Although RMG is a separate company, we are considering factors in our permit that relate to anything that gives rise to concerns about the safety and acceptability of their operation.
Everyone, let's do our best to just ask one question. We're already, over time, and we want to address as many questions as we can. So if you have a follow-up question to your original question, just put the follow-up in the chat or in the Q&A, and we'll make sure that it gets responded to after the meeting. So just one question at a time, please.
All right. Jocelyn, you're allowed to speak, so you can unmute yourself.
Hey there. Thank you for the opportunity to speak. I appreciate that very much. I'm just, for those that don't know, because I've been a few of these before regarding the community meetings, regarding various pollution issues in the area. I am a registered nurse, a longtime resident. My father was a second generation steel worker, so I understand industry and I also understand health impacts You guys have yourself acknowledged the data showing higher incidences of comorbidities in our area, health comorbidities. An example would be the health impact and air quality index that you referenced earlier. However, you all have also acknowledged the limitations of data, how that can be in an area like ours, especially in our community, because we lack access, we lack health resources. Issues like job and food insecurity and financial barriers might not always paint a clear picture. So my question, and it's very clear and precise, with the highlight of the importance of listening to frontline health workers over this last year's pandemic, has CDPH made an effort, I'm so sorry about that, to reach out and document feedback from local healthcare providers such as ER doctors, pulmonologists, neurologists, and pediatric providers in our area, specifically regarding morbidity and mortality in our local patient population? And if you guys have contacted and reached out to those providers, have you asked how COVID has added to our cumulative health burden within our residents? And that's my questions.
Yeah, that question is clear, and thank you for raising concerns about what the data does not and cannot show when people perhaps have barriers that prevent them from accessing care. So we certainly do acknowledge that. Our health impact assessment will speak specifically to those limitations as we have tonight. I do want to say broadly that our HIA does not shy away from the fact that there are health inequities that persist on the southeast side of Chicago, and that there are underlying social and institutional racist structures that perpetuate those health inequities. We have been direct about that in Healthy Chicago 2025, and that animates our commitment to longer term policy and systems change. So we take the point about the importance of qualitative input from physicians, from providers, from nurses, such as yourself, and we do want to be clear that we understand, and we are going to incorporate some of that information as part of the HIA. I also want to emphasize that the HIA is a work in progress here. So the input that you are giving us is helping to inform the direction that we take. The foundation of the HIA was information that we received from various sources early on in the permit process. All of the comments tonight are being captured. We're taking notes, we're recording the chat box, and the HIA will be responsive to those things where they are relevant and where they are really related to this project. So this is a form of qualitative input that you all are providing for us now as well.
Okay, I'm going to read James' question. Wasn't the data submitted by Southside Recycling and approved by Illinois EPA based on worst case scenarios plus 175% of the facility's capacity? So in other words, a level can never be reached, yet the emissions would still well be within compliance of existing regulations.
I could probably answer that. So I've heard of that number. I have not seen it as far as demonstrated as part of my permit review. But the whole point of this HIA is basically the phase 2 of it is looking at, detailed modeling and emissions inventory and emissions calculations and dispersion and, in-depth air dispersion modeling and health risk modeling. So, if that's the case, that will bear out in the analysis.
Okay. I'm going to be elevating Matthew to speak. Matthew, you are now elevated and can unmute yourself.
Hi, good evening. My name is the Reverend Matthew Zamanek. I serve as a community chaplain at the Southeast Environmental Task Force in partnership with the Metropolitan Chicago Synod of the Evangelical Lutheran Church in America, and I use pronouns like he and they. And to preface my question, I want to just say that I'm angry that the concerns of community members have been ignored this evening and that there's been a lot of performative empathy here. Angry that turnout was driven by community leaders and that our elected officials and CDPH wasn't actively promoting this in the community. And I'm angry that people had to take valuable time out of their day, especially people who work longer hours for lower wages, because we are a working class community, a community of color, which means we earn less than white counterparts, on a process that is pretending to be participatory when it is clear that the CDPH has been designing this process for several months without any community input. And so I want to ask, how will our input be meaningfully added to this process? And how have community members already been involved in the shaping of this process from the design area? And this is possible. SETF does work with the Community Engagement Corps through Cachet, which is a partnership between University of Chicago and UIC. And we have scholars that work with us with different studies and scholars that have disagreed with the analysis presented here. And so I'm asking, how have community members been involved in the design of this process since Michael Reagan wrote that letter by the EPA and Lori Lightfoot responded?
So as we've discussed at various points tonight, I want to first say that your comments about what the emotional burden is of being asked to continue to come to these meetings and share the input and the power dynamics that are at play here. I want to also name those and say that we are working to improve our practices and our processes, and we take seriously the feedback that you are giving us tonight, that there is more that we can and must do. As a city, we are working to really institutionalize our health and racial equity impact assessment practice as part of decision making, and that is taking various forms. And I think that we are hoping that we're building this muscle, and we are getting better at it as we go, because we must. It is imperative that we continue to really center equity and racial justice in this work. So this meeting and all of the work that has come before it are critical parts of this process to solicit your input and to use it to inform the report. You asked specifically how. Community input has shaped the way that we scoped this process. It has shaped the way that we have centered racial justice and equity by being explicit about comparing conditions on the Southeast side to Lincoln Park. And it has been considered in the way that we are trying to look at more cumulative impacts of pollution and of environmental burden and health vulnerability as part of our strategy here. So, that has come from feedback that we have and continue to receive. But I certainly do acknowledge the point that there is more that we can strive for in this process, and importantly, as we look even more fundamentally at policy and systems change.
Okay, I am now elevating Jocelyn to speak. Jocelyn, once you're ready, you can take your mute off.
Well, you already answered my question. I think I had just left in the chat that since it wasn't acknowledged whether or not local healthcare providers had been contacted regarding their feedback to capture some of that data that may not always be collected during an actual study. When that is, if and when that happens, that data needs to be made publicly available so that members of the community can see what our local healthcare providers are saying regarding the health burden that our residents face. So that was basically my point, was that there needs to be the transparency and accountability. It needs to be available via FOIA request. It needs to be accessible to anybody who wishes to look at it.
Yes, thank you. And so we have spoken with Jocelyn tonight, but to the point about transparency, that is our commitment, that the data that is being used for this process, the information and findings from the various components of the assessment will be publicly posted on the website.
Megan, given the time, how many additional questions would you like for us to allow participants to ask?
I believe we have our interpreter until 7:30, so we can probably get through another 2 to 3 questions if I'm concise, and then we may want to just briefly go through next steps for the benefit of the group as well. Does that sound all right, Makara?
Yeah, that sounds fine. And I just also want to let the group know that we have captured your concerns in the chat about the format of this meeting and your desire to have more participation in the follow-up meetings. And so we will make accommodations and adjustments to be able to honor that request. So just be on the lookout for a reach out from a member of this presentation team to do just that for the next meeting. No, so you can go ahead and sure.
Yeah, and I also want to, just really underscore that we, are committing to responding to questions that we don't get to tonight. We'll make sure that we have some written materials for the benefit of this group to inform going into the next meeting.
So Nosa, I'll let you ask the last three questions.
Okay.
Well, no, excuse me, not let you ask the last three questions, but identify who will ask their question. But just three people, please.
Yes. Amalia in the Q&A had a question. Amalia, if you would like to say it out loud, I can elevate you if you just raise your hand. Perfect. So you've been elevated and you can unmute yourself now.
Hi, I'm not sure. I had several questions. One of the biggest questions I think I had was, I know that I think there are two questions. One is, how do community members respond to the data and the issues that were released tonight? And I just put in chat, not just the input during the community meeting, but what about just being able to respond to what we've heard tonight? And then the other thing is, I was wondering about the process for the HIA, because I know it was said that this has been in process since last summer, but I know Michael Regan only and the city delayed the city delayed the permit in May. So to do the HIA. So I'm wondering how the HIA process was started last summer when the city announced it would be starting this May. And I'm just curious because that means that there hasn't been community input on the HIA specifically, on the permit, yes, but not the HIA. So I was just wondering if you could explain those two things.
Yep. Yes, certainly. So to the first question about how to engage between meetings, we are happy to take feedback on tonight's session and any questions that you have further related to any of the content that we've presented. The best way to reach out is to email us at envcomments@cityofchicago.org. That email will be included with the slides and materials that we'll send to you by email, as well as posted on our website. And we are happy to continue to engage that way between sessions too. To the second point about... Can
you put the email in chat? Because I totally did not understand which letters those were.
Sorry. We can do that. envcomments@cityofchicago.org. If another of our panelists could please go ahead and put that in the chat box. And again, it'll be on our final slide here. To the second part of your question, when I say that the HIA was sort of embarked upon at the beginning of CDPH's review of the permit, our department, our Office of Environmental Permitting and Inspections, lives in the city of Chicago within the Department of Public Health. And so the work that we do is informed by a health lens. And we have been intentional, even dating back to summer of last year, in really understanding, based on community impacts, what are the likely sort of health effects. But you are correct that it was after the US EPA and Administrator Regan, sort of called upon the city of Chicago to conduct a more formal analysis that we carried that information forward and tried to put a real structure and a transparent process that centers environmental justice and equity forward. And so that is the process that is ongoing now. That is the commitment that we are making through this process, and that will inform the final report. So all of this work that preceded, that kind of the engagement with the US EPA is being brought forward and brought to bear as part of the final assessment and analysis.
Victoria had a question. Victoria, if you would like to be elevated, just raise your hand and I will elevate you to speak your question out loud. And Frolian had a question as well. So if you would like to be elevated to speak your question out loud, you can just raise your hand and I will elevate you. So Frolian and Victoria. Okay, I will speak this question out loud. It says, will CDPH conduct a comprehensive soil study of the site given the long history of contamination? And this is by Victoria Persky.
Ro, would you like to speak to the scope of that review?
Sure. We have some data that was collected and submitted to IEPA as far as the concentrations and metals of particulates on the RMG property. So we'll utilize that data. Also, as far as background data, we'll also go back and look at all the soil sampling that were done around the community as far as, to basically form what the background concentrations are.
Okay. And
is there an answer or a response to that question?
That was the response.
Okay.
Okay, so Frolian Nunez will be the last question. I will elevate Frolian to speak, and then we'll wrap up after this. Okay, Frolian, you're elevated. And
Hi, this is Ted. I got identified as Frolian because I used his site, but my question was about the health impact study. Doesn't take into account lifestyle, health habits, smoking, diet, sedentary living, preventive medical exams, and so forth. How will that be taken into account when you're doing a health impact study? Will you be able to capture empirical data over decades to be able to take that into account?
For this question, I wonder if Kate McMahon, our Director of Chronic Disease Prevention and Health Promotion, might want to respond.
Sure, I can take that, Megan. So yes, you are right in that there are a number of factors that influence our health. However, we know that healthcare is only a small portion of what impacts our health, and that actually social and economic factors, some of the systems of advantage and oppression that have been discussed tonight play a much larger role in our health. And so, as Kirsty mentioned, we are looking across a number of pathways in what we are considering as part of this health impact assessment.
I mean, I was told, I'm a Hegewisch resident. I was told smoking was the biggest impact, more than being a steel worker. And I worked on at Republic Steel for 15 years as an hourly worker, actually on reserve management property. That the biggest effect on my health was the years I smoked, more than anything else, by my cardiologist at the University of Chicago. And unless that can be disputed, I probably agree with that. And goodness, I quit a long time ago, but according to, they say the best thing you can do is quit smoking. So I don't know. That's what I've been told. Empirical data seems to support that more than anything else.
Okay, thank you. We didn't hear the tail end of what you were sharing. Your sound cut out a bit, but if you want to expound on that, you can definitely add it to the chat. At this time, I'll allow Megan to talk about the next meeting and the topics that will be addressed during our next meeting.
Thank you, Makara. And thank you again for everyone who attended and who stuck with us during some challenging conversation. This is an important part of the process for our health impact assessment, and we do appreciate your input, and we recognize that we've asked a lot to have you with us here tonight. So to review, though, what we have done together, we discussed the purpose and process of the health impact assessment and described how we are applying that to evaluate the Southside recycling permit application. We are working with you to identify potential community burdens and benefits. And then we discussed current environmental health and quality of life conditions on the Southeast side with both the US EPA's ambient air quality review, as well as information from CDPH on health, quality of life, and other social factors. And then we compared these conditions to Lincoln Park and to the city overall. Next slide, please. That effort carried us through the first 3 steps of health impact assessment process: screening, scoping, and an initial work on assessment by looking at baseline conditions. We will pick up on that next month with our next session as we do part 2 of assessment with the modeling and risk assessment work that Renante was describing. We will also then push into step 4 of recommendations at the next session. So in order to be best prepared to engage, we wanted to put a couple of questions out there for people to consider in the meantime. First was what could be done to maximize benefits and mitigate burdens that we discussed today. And then also, more broadly, because we talked about the fact that although our HIA is targeted towards the decision on the permit, we recognize this as part of an ecosystem of policies and processes and laws that folks feel strongly need to change to better protect vulnerable communities. We want to put that question to you about what are the changes that the city should consider based on what we have learned from this experience with this particular permit. So please do take some time to think about these questions in advance of the next session, and we hope very much that you will continue to join us. Next slide. And finally, as many of you have noted in the chat box throughout the session, we are inviting your feedback to help us improve, to help us be truer to our values. If there are any parting thoughts that you would like to share with us in the chat box about one main takeaway that you're bringing from the conversation this evening, about something that went well or something that you think we could do differently and better next time, I think there has already been a lot of that feedback. We will, as I said, review that both to inform our HIA and to inform how we engage in the rest of this process. So finally, to stay involved, our next session, as I mentioned, focusing on assessment and recommendations, will be held on Thursday, December 2nd from 5 to 7 p.m. Details on how to register will be shared by email. Everyone who registered today is, of course, invited to come back and join us again, so you'll get a direct outreach. We'll also be continuing our broad outreach through various channels like the Mayor's Office of Community Engagement, work with Alderwoman Susadlowski Garza, work through the local chambers and stakeholders in order to invite people to subsequent meetings as well. Today's session and all related materials are now posted or will be posted shortly on our website so that you have them for ready reference. I hope that at some point we got into the chat box what that URL link is. If not, we'll make sure that goes out by email too. And again, to the question earlier about if you want to give input or go deeper on any of the content from today's session before we meet in December, you can email envcomments@cityofchicago.org. That email account is actively monitored and we will respond that way. And then further, for the questions that were raised today that we didn't have an opportunity to touch on, again, we plan to respond to those in writing and we will be posting those along with other materials. So with that, unless there are any comments from my fellow panelists, we'll just turn it over to Makara to finally close us out.
Thank you, Megan. Thank you for spending your evening with us in this conversation. As Megan already mentioned, we are going to capture all of your feedback back and suggestions from the chat on how to make the next meeting more interactive. We'd all rather be in person having this conversation, looking at each other's faces. This is a very impersonal way to talk about something that impacts all of your lives in a very personal way. Just some of the quick feedback that I grabbed from the chat that we are going to make sure that we implement is to send links to data ahead of the meeting. So you can look at full reports and have some detailed questions, as well as we will be reaching out to a lot of you to see what your availability is to participate and be one of the presenters during the next meeting. So this is a work in progress. Thanks for coming along this journey, and that is not an easy one. So again, you will be hearing from us. We would like to hear from you, and we will see you next month. Have a great evening. Good night. And just to let everyone know who's still here, do not be alarmed. We are going to be removing folks from the meeting just to close out the meeting. Sorry to kick you out, out of the room. Yes, post the meeting time so we can discuss how to do better. We want to evolve every day. Thank you.